Alright, this is Pack 365, myself Srija. Today you are going to learn about the anatomy and physiology of diaphragm and also the medical terminology of the respiratory system. This is the introduction of the diaphragm. So what is diaphragm? It is a dome-shaped muscle plus tendon sheath. So it separates the thoracic cavity from the abdominal cavity. So what is the structure and function of the diaphragm? So the diaphragm, it forms the floor of the thoracic cavity and roof of the abdominal cavity. So this diaphragm, in its relaxed state, it has a dome shape curving upward into the chest cavity. So this diaphragm, it is attached to the lower ribs, sternum and also the lumbar vertebrae. Here you can see the picture of the diaphragm. You can see the trachea, bronchus, bronchioles that carry air into the lungs. So the lungs are shown inside the rib cage. This is the rib cage and the lungs are inside view of the lungs. So diaphragm is a red covered muscle below the lungs. The ribs and cutaway section, they help show its position between the chest and abdomen. So the diaphragm is the primary muscle of the respiration. So during inhalation, so when you take the oxygen into your body, the diaphragm contracts. So when it contracts, it moves downward. So this makes in increasing the volume of the thoracic cavity. So when you inhale oxygen into your body, what does happen? So diaphragm gets contracted and then it increases the volume of the thoracic cavity. So this allows the lung to expand. So it expands. So during exhalation, so when you exhale the carbon dioxide outside, what it happens? The diaphragm, it relaxes and it moves upward. So this decreases the thoracic cavity volume so that it pushes the air out of the lungs. So this is the primary muscle of the respiration. So this diaphragm, it is about 75% of the air movement during quite normal breathing. So when you take a deep breath and feel the abdomen rise, so that's the diaphragm contracting. So how the dome flattens during inhalation and returns to its dome shape during the exhalation. So coming to the next slide, anatomy of the diaphragm. So it is a muscular partition, right? Diaphragm is a muscle. It's nothing but a muscle or a muscular partition. So this separates two major body cavities. So what are the two major body cavities? So thoracic cavity and also the abdominal cavity. In thoracic cavity, this lungs and heart are present in this thoracic cavity. Whereas this abdominal cavity, the other organs, the digestive organs such as the stomach, liver and intestines are present in the abdominal cavity. So in between these, a diaphragm is present and it separates both the cavities. So this acts like a dividing wall between the chest and the abdomen. So diaphragm is attached all around to the lower ribs, sternum and also the vertebral column. So you can describe this diaphragm as a muscular floor of the chest or also the roof of the abdomen. So what is the shape of the abdomen? You can see in the picture, it's a dome shape, right? It looks like the dome shape, like an upward curved umbrella when relaxed. So dome shape is nothing but when the umbrella, it gets upward curved, so it forms a dome shape. So diaphragm is a dome shape. So it has two domes. One is right dome and one is left dome. You have two rungs, right? So in the same way, dome is also the right one and the left one. So these two domes are called as hemidiaphragms. So what does this light rope do? Right dome do? This is a slightly higher. You can see the right one is, it's a slightly higher, whereas left dome is slightly lower. So right dome, it is slightly higher because the liver lies just beneath it. So just beneath the right dome, the liver is present. Whereas coming to the left dome, just below the left dome, the stomach and spleen are present. So it is a lower and it is slightly higher. So the shape is not flat. It curves upward into the chest cavity. So what is the function of the diaphragm during the breathing. So when the diaphragm contracts, the dome gets flattened downward. So what does this do? This increases the volume of the thoracic cavity. So as a result, it increases the volume of the thoracic cavity. The lungs expand and the air is drawn in. So when air is drawn in, it is called as inhalation. What is inhalation? Taking of the oxygen into the body. So when the diaphragm relaxes, it returns to its dome shape, pushing the air out. So this is called as exhalation. So what do you mean by exhalation? Taking out of the or removing the carbon dioxide out of your body. So this diaphragm has two main parts. So what are they? Muscular part and central tendinous part, nothing but a central tendon. So diaphragm has two main parts. You can see over here, this is the central tendon of diaphragm. This is the right dome, as I said, you know itself, right dome, left dome. This is the diaphragm and this is the central tendon of the diaphragm. So muscular part. So in this slide, we are focusing on the muscular part. So what is muscular part? The muscular part of the diaphragm, it originates from three main regions. So which together form the dome-shaped structure. So what three main regions? Sternal part, coastal part and lumbar part. Right. So sternal part, coming to the sternal part. So the sternal part, it originates from the posterior surface of the xiphoid process. So lower tip of the sternum. This is also called as the front portion of the diaphragm. So the front portion of the diaphragm is the sternal part. Coming to the coastal part. It arises from the inner surface of the lower 6 ribs and their coastal cartilages. So what does this coastal part is? It forms the largest portion of the diaphragm. So in diaphragm, the muscular part has three regions. Among the three regions, this coastal part is the largest part of the lower diaphragm, curving along the sides of the thoracic cavity. So next, coming to the lumbar part. This lumbar part, it forms the back portion. So muscular part, coming to sternal part, it's a front portion and lumbar part is the back portion. So coastal part is the largest portion. So lumbar part, it originates from the upper lumbar vertebrae into two tendinous structures. What are the upper lumbar vertebrae? L1 to L3. You can see over here L1 to L3. So this originates from the L1 to L3 through two tendinous structures called crura. What are they called as crura? On right or left crus. So also connected by the accruate ligaments which forms the arches over the nearby muscles. So the diagram, the red colored muscle over here you are watching, right? In the diagram, the red colored muscle fiber shows the muscular part. Everything within the red color is the muscular part. So the central tendon part is the light blue or the white area in the middle is where all the muscle fibers insert. So you can see important openings also here for vena cava, opening for vena cava at T8 level. This is the 8th level, this is T8 level, and also for opening for the esophagus at T10 level, and for opening for the aorta at T12 level. So over here you can find the right crus of the diaphragm and also the left crus of the diaphragm. So all these openings for vena cava, esophagus and aorta, this allows the important structures to pass between the thorax and abdomen. Right. So the diaphragm comes from the sternum and also the lumbar vertebrae, nothing but back. So all these muscle fibers meet at the central tendon. So the next part is the central tendon. So what is central tendon? It is a strong flat structure found at the center of the diaphragm, or it is located at the center of the diaphragm. So the coming to the muscular part, it is muscular part, right? This central tendon, it is a non-muscular part. So when you think this as a heart of a diaphragm, so it is a central point where all the muscle fibers meet. So what is the structure and function of the central tendon? This all the muscle fibers of the diaphragm, it coverage towards this tendon. So tendon acts as, you can clearly see over here in the picture, the central tendon. So this act as an insertion point of these muscles. So when the diaphragm contracts, the muscle fibers pull out the central tendon because it moves slightly downward, right? So this helps the increasing the volume and also inhalation. So if you imagine the central tendon as a parachute, so the muscular parts are like the fabric edges and the central tendon is like the ring in the middle where all the ropes join. So when the edges are pulled, so the center moves slightly, helping air fills the lungs. So what is central tendon? It is a fibrous center of the diaphragm. So muscles attach to it and they pull during the inspiration. So pericardium is fixed to it. So it's a stationary point during the contraction. And then coming to the physiology of the diaphragm. So diaphragm is the main muscle responsible for the breathing, right? As I have told you in before slides, it is the main muscle responsible for the breathing. So helping air move in and out of the lungs by changing the volume of the thoracic cavity is the main function of the diaphragm. So inspiration, inhalation or exhalation. These are the role in breathing. So during inhalation, what happens? As you can see in the picture over here, during inhalation, the diaphragm contracts. So when it contracts, it flattens downward, right, from its dome shape. So after contracting downwards, so this increases the space in the thoracic cavity. So as the space increases, the pressure inside the lungs decreases and the air is drawn into the lungs. So contraction, flattening and thoracic volume increased and air enters into the lungs. So in short, you can remember this as easily. What are they? Contraction and then flattening and then thoracic volume increased and then air enters into the lungs. So the next one in role in breathing. What it is? Expiration, nothing but exhalation. So during exhalation, the diaphragm relaxes. So this moves upward to its dome shape again. So this reduces the space in the thoracic cavity. So as the volume decreases, the air pressure inside the lungs increases and the air is pushed out. In short, inhalation means contraction, whereas exhalation means relaxation. In inhalation, here the thoracic volume increases and in exhalation the thoracic volume decreases. So diaphragm gets pulled down and here diaphragm gets pulled up. So the next one, the role in pressure regulation. So when the diaphragm contracts, it also increases the pressure in the abdominal cavity. So what does this pressure helps in functions like defecation, urination and also the childbirth. So the diaphragm doesn't just only help us to breathe, it also helps to push the air forces, right? So role in circulation. Diaphragm also functions in role in circulation. So what does it do? It does the diaphragm's movement during breathing helps venous blood return to the blood. So during breathing and during diaphragm's movement, this helps venous blood return to the heart. So when it moves down during the inspiration, it also reduces the pressure in the chest, which what does it do? It helps blood to flow back from the abdomen to the heart. So then role in reflexes and other functions. So what do you mean by this? The diaphragm is also involved in reflex actions. So nothing but coughing, sneezing, vomiting and laughing. These are all the reflex actions. So the left image shows inhalation and the right image shows exhalation. So in the left image, so the right image shows exhalation. So the diaphragm relaxes and moves upward over here. The lungs shrink and the ribs move down and the air is pushed out. Here the lungs expand and the intercostal muscles lift the ribs and the air enters into the lungs. So when you inhale, you will feel the diaphragm moves down. So when you exhale, you will feel like it moves inward or up. So this is all about the anatomy and physiology of diaphragm. So now next coming to the medical terminology of the respiratory system. So medical terminology. So medical terms are often built from word parts, mainly word root or root word, prefixes and suffixes. So what is root word? So it gives the basic meaning of the term, usually referring to a body part. So in this slide, we are learning the word roots related to the respiratory system, the organs that help in the breathing. So what are the medical terms? What are the root words? Naso. Naso means nose. Like in example, rhinorrhea, right? So what is meaning? It means runny nose or discharge from the nose. And then sinuso. Sinuso means sinus. For example, sinusitis, nothing but it's an inflammation of the sinus, or this causes the headache or the facial pain. So next one, pharyngo. So pharyngo means pharynx, pharyngitis, so inflammation of the throat. Laryngo means larynx, nothing but voice box. For example, laryngoscopy. So laryngoscopy is when doctor uses a small scope to look inside your voice box. So trachea or windpipe. For example, tracheostomy. It's a surgical procedure that creates an opening in the trachea to help a person breathe. So next coming to broncho. Broncho means bronchus. For example, bronchitis means inflammation of the bronchial tubes. So this makes breathing difficult and it causes the coughing. And next coming to the prefixes. So what are prefix? In medical terminology, a prefix is added to the beginning of a word to change its meaning, right? It is prefix is nothing but adding a word before the adding a beginning of the word. So this prefix usually describes the location, number, time, speed or degree. So whenever this prefix is combined with a word root, they help us to understand the exact condition or the process. So this slide explains the prefixes commonly used in respiratory system terms. So what it is? A or an, nothing but without or absence of. For example, apnea. Apnea means no breathing or absence of breathing. And the next prefix, brady. Brady means slow. Example, bradypnea. Apnea means breathing, right? So brady means slow. So abnormally slow breathing. So tachy. Tachy means fast. Abnormally fast breathing. So dis. Dis means difficult or painful or abnormal. So dyspnea. Example is so that nothing but difficulty in the breathing. So hyper, the next prefix is hyper. Hyper is nothing but excess, excess or too much, right? So breathing too fast or too deeply. And hypo means low or too little. For example, hypoventilation. The meaning of hypoventilation is breathing too slow or shallow. So the next prefix is endo. Endo is nothing but within. For example, endotracheal and inside the trachea. So people with asthma often experience dyspnea. So during sleep apnea, a person stops breathing for short periods. So to create, if you create the words or sentences like this, it will be very easy to you to understand the prefixes. So next coming to prefixes, after prefixes, suffixes. So what is suffix in the medical terminology? It is added to the end of a word root. Prefix is adding before the beginning of the word and suffix is the end of the word root to modify or expand its meaning. So what does this suffix often describe? They describe a condition, disease, procedure or a process. So this helps in understanding the suffixes, identify what kind of medical issue or action is being referred to. So here are some suffixes. The first one is nia. Nia means breathing. Dyspnea means difficulty in breathing or bad in breathing. So next suffix is oxia. Oxia means oxygen. For example, hypoxia. What is the meaning of hypoxia? Less oxygen in the body tissues. And the another suffix, capnia. Capnia means carbon dioxide. So example, hypercapnia, excess carbon dioxide in the blood. So thorax. Thorax means chest or pleural cavity. What it is? Pneumothorax. means air in the pleural cavity. So air trapped in the chest cavity that collapses the lung, nothing but pneumothorax. And the next suffix is spasm. Spasm is nothing but the sudden contraction. For example, bronchospasm, the constriction of the bronchial muscles. And the next suffix is itis, inflammation, bronchitis, inflammation of the bronchi. Ectomy, surgical removal. For example, lobectomy. Lobectomy means a removal of a lobe of the lung. So, break down each word. For example, if there is bronchitis, break down each word. Broncho, airway, itis, inflammation. So, use visual aids like the diaphragm of lungs or pleural cavity. So, you can create a new medical terms using all the suffixes, prefixes, and also the medical root words. So this is all about the suffixes of the respiratory system, and this is all about today's session. In the next session, you will be learning about the ICD-10-CM general guidelines for respiratory system and also ICD-10-CM classification and the code ranges for respiratory system disorders and diseases. Thank you.